Welcome to the Ultimate CNA Guide, your comprehensive resource for mastering the essential skills and practices of a certified nursing assistant. This guide is designed to provide a step-by-step overview of the crucial aspects of CNA work. Whether you're just starting your journey in healthcare or looking for a refresher, this guide has something for you. Being a CNA is incredibly rewarding. You'll play a vital role in providing direct patient care, assisting with daily living activities and ensuring the well-being of those entrusted to your care. Throughout this guide, we'll delve into the core skills and knowledge you'll need to excel in this demanding yet fulfilling profession. From basic patient care and infection control to vital signs monitoring and assisting with mobility, we'll cover it all. We'll also explore specialized areas such as wound care, end-of-life care, and the importance of effective communication. Remember, this guide is intended to complement your formal CNA training and should not replace the guidance of qualified instructors or healthcare professionals. So, let's get started on this exciting journey to becoming a skilled and compassionate certified nursing assistant. As a CNA, you'll be the heart of healthcare, providing direct, compassionate care to patients. You'll work closely with nurses, doctors, and other healthcare professionals. Common tasks include assisting with personal hygiene and taking vital signs. You'll also help with mobility and provide emotional support. Observing and reporting changes in a patient's condition is crucial. Accurate documentation is essential for patient care. The role is diverse and demanding, but incredibly rewarding. Respecting patient rights and maintaining confidentiality are paramount in healthcare. As a CNA, you play a vital role in upholding these principles. Patients have the right to be treated with dignity, respect, and compassion. They have the right to privacy, which means knocking before entering. Patients also have the right to be informed about their care. Explain these aspects clearly and understandably. Confidentiality is crucial. Protect patient information at all times. HIPAA sets strict guidelines for safeguarding patient health information. By adhering to these principles, you'll ensure your patients feel safe and respected. As a CNA, you're on the front line of defense against infection. Infection control and hygiene practices are paramount. The most effective way to break the chain of infection is through meticulous hand hygiene. Wash your hands frequently, especially before and after patient contact. If soap and water aren't available, use an alcohol-based hand sanitizer. Hand hygiene is the single most effective way to prevent infection. Maintain a clean and sanitary work environment. Clean and disinfect frequently touched surfaces regularly. Properly dispose of contaminated materials in biohazard containers. Adhering to these practices creates a safer environment for everyone. Your diligence protects yourself, your patients, and your colleagues. Personal protective equipment, or PPE, is your suit of armor in the fight against infection. It acts as a barrier to prevent the transmission of germs and protect you and your patients. Common types of PPE include gloves, masks, gowns, and eye protection. Change your gloves between tasks and always perform hand hygiene after removing gloves. Masks protect your nose and mouth from respiratory droplets. Donning and doffing PPE correctly is crucial to ensure its effectiveness. Mastering PPE use creates a safer and healthier healthcare environment. As a CNA, you'll become well acquainted with the rhythm of health vital signs. These measurements provide essential clues about a patient's overall well-being. Mastering these techniques is crucial for safe and effective patient care. We'll cover temperature, pulse, respiration, and blood pressure. Temperature assessment can indicate fever or infection. Pulse measurement involves feeling the rhythmic expansion of arteries. Respiration assessment is vital for monitoring breathing patterns. Blood pressure measurement reflects the force exerted by blood against artery walls as the heart pumps. It's recorded as two numbers: systolic pressure when the heart contracts and diastolic pressure when it relaxes. Proper cuff placement and inflation are essential for accurate readings. Listen for Korotkov sounds to determine systolic and diastolic pressures. Record these numbers accurately for monitoring cardiovascular health. A helping hand, guiding safe movement. Assisting with mobility is fundamental, ensuring patients move safely and maintain independence. Whether it's getting out of bed, walking or transferring to a wheelchair, your role is crucial in preventing falls and promoting mobility. Remember proper body mechanics. Communicate and encourage patient participation. Use your legs, not your back, to avoid injury. Ensure the area is free of clutter and obstacles. Ensure patients wear non-slip footwear. Patience and encouragement are key. Assistive devices, tools for enhanced mobility. Assistive devices such as canes, walkers and wheelchairs enhance patient mobility and independence. As a CNA, ensure proper use and fitting for safety and comfort. Empower patients to participate in their mobility. Preserving dignity through personal care. As a CNA, you'll play a vital role in helping patients maintain their personal hygiene. Many patients may feel vulnerable or embarrassed about needing assistance. Approach each interaction with empathy and respect. Bathing not only cleanses the skin, but also provides an opportunity to observe for any skin issues. Oral care is another crucial aspect of patient hygiene. Proper denture care is equally important. Grooming goes beyond basic hygiene and boosts a patient's self-esteem and well-being. Hair care, shaving and nail care are essential for patient dignity. Be gentle to avoid pulling hair. Use a wide-toothed comb and ask for hairstyle preferences. Shave carefully with a clean razor and shaving cream. Trim nails straight across to prevent ingrown nails. Grooming promotes dignity and self-worth. Approach grooming with compassion and respect. As a CNA, you'll play a vital role in assisting patients with their nutritional needs. Understanding different diet types and safe feeding techniques are essential. You'll encounter various dietary restrictions tailored to medical conditions. Common diets include regular, mechanical, soft, pureed, and liquid diets. Always double-check the patient's diet card before serving meals. Prioritize comfort and safety when assisting with feeding. Use a spoon, offer small bites, and allow time for chewing. Observe for signs of difficulty. Swallowing and notify nursing staff if needed. Monitoring a patient's intake and output, or I&O, provides valuable insights into their fluid balance and health. As a CNA, you'll measure and document fluid intake and output, crucial for the healthcare team. Fluid intake includes water, juice, soup, and IV fluids. Fluid output includes urine, vomit, diarrhea, and wound drainage. Accurate I&O documentation is crucial for identifying fluid imbalances. The art of bed making, creating a haven of comfort. As a CNA, you'll master bed making, turning a simple bed into a haven of comfort and rest. A well-made bed promotes well-being and prevents skin breakdown and pressure ulcers. We'll start with unoccupied bed making, mastering smooth, wrinkle-free techniques. Gather all necessary linens, fitted sheet, flat sheet, drawer sheet, blanket and pillows. Fit the bottom sheet snugly, avoiding wrinkles. Spread the flat sheet, aligning the top edge with the mattress head. Tuck the bottom edge securely, creating neat hospital corners. Smooth out wrinkles, ensuring the sheet is taut. Occupied bed making, a symphony of skill and compassion. This involves changing linens while the patient is still in bed, requiring skill, efficiency and compassion. It's used for patients who can't get out of bed or have limited mobility. Minimize disruption and ensure patient comfort and safety. Communication is key. Explain each step and reassure the patient. Encourage patient assistance to maintain their independence. Adjust the bed height and raise bed rails to prevent falls. Loosen and roll dirty linens inward to contain contaminants. Roll clean linens starting with the bottom sheet and tuck it under the mattress. The watchful eye. Noticing the subtle cues. As a CNA, you are the watchful eye, the ever-present observer of your patient's well-being. Your role goes beyond simply providing care. It's about noticing even the subtlest of changes. These observations are invaluable to the entire healthcare team. Think of yourself as a detective, piecing together clues from your interactions. Pay close attention to their physical appearance and behavior. Are there any new rashes, sores, or areas of redness? Has their skin color changed? Notice any swelling in their extremities. Be attuned to changes in their behavior and mental state. Is the patient unusually confused or agitated? Are they experiencing increased anxiety or sadness? These shifts could signal issues like medication side effects or infection. Your observations extend to their vital signs. Document and report any significant deviations promptly. Early detection is key. By noticing and reporting these changes, you play a critical role in ensuring timely interventions. Section 2. Clear communication, the lifeline of patient care. Observing patient changes is only half the battle. The other half is effectively communicating your findings to the nursing staff. Clear, concise and accurate communication is the lifeline of patient care, ensuring that everyone on the healthcare team is informed and able to respond appropriately. When reporting changes, be specific and objective, avoiding assumptions or interpretations. Instead of saying, "Mrs. Smith seems a little off today," provide concrete details. "Mrs. Smith is more confused than usual. She was unable to recall her name or the date, and she kept asking for her husband, who passed away last year." Document your observations thoroughly and promptly in the patient's chart, using factual language and avoiding subjective opinions. Include the date, time, and specific details of the change you observed, as well as any actions you took, such as notifying the nurse. Remember, effective communication is a two-way street. Don't hesitate to ask clarifying questions if you're unsure about something or if you need further instructions. By embracing open communication and advocating for your patients, you become an indispensable member of the healthcare team, ensuring their safety and contributing to the best possible outcomes. Section 1. A gentle approach, the fundamentals of wound care. As a CNA, you'll play a supportive role in basic wound care, assisting nurses with dressing changes and monitoring for signs of infection. While you won't be performing complex wound care procedures, your understanding of the fundamentals is crucial for ensuring patient comfort and safety. Wound care begins with careful observation. Before assisting with a dressing change, take note of the wound's location, size, and appearance. Look for any signs of redness, swelling, warmth, or drainage, which could indicate infection. Also note any pain reported by the patient and their overall level of comfort. During the dressing change, maintain a gentle touch and reassure the patient throughout the process. Explain each step to them, especially if they're feeling anxious or uncomfortable. If the patient experiences pain, stop the procedure and notify the nurse immediately. Remember, even basic wound care requires strict adherence to infection control protocols. Always wear gloves when handling dressings or touching the wound area. Dispose of used dressings and other contaminated materials properly, following your facility's guidelines for biohazard waste. Mastering sterile technique. Sterile technique is paramount in wound care, minimizing infection risk. Understanding sterile technique is essential for any CNA assisting with wound care. Sterile dressings are specially packaged to ensure sterility. Ensure your hands are clean and you're wearing gloves. Avoid touching the inside of the sterile dressing. Be mindful of your movements and avoid reaching across the sterile field. Notify the nurse immediately if you contaminate the sterile field. Properly securing the dressing is crucial for maintaining its integrity. Use sterile tape or bandages to secure the dressing. Avoid taping directly over the wound. Adhering to these principles promotes wound healing and prevents infections. Navigating the final journey. A CNA's role in end-of-life care. End-of-life care is a sacred journey. As a CNA, you provide comfort, support, and dignity. Compassion, empathy, and a gentle touch are essential. Be present. Your presence alone is comforting. Sit with them, hold their hand, and listen. Offer words of encouragement and reassurance. Ensure physical comfort and manage pain. Maintain a calm and peaceful environment. Comforting words and gestures. Providing emotional support. Emotional and spiritual support are crucial during end-of-life care. Patients and families may experience sadness, grief, fear, and anxiety. Your compassionate presence and listening ear can provide invaluable comfort. Encourage open sharing of feelings and concerns. Sometimes just listening can be incredibly therapeutic. Respect spiritual beliefs and offer to contact a chaplain if needed. Families also need support during end-of-life care. They may struggle with decisions, grief, or feeling overwhelmed. Offer a kind word, a warm blanket, or a listening ear. Let them know you're there for them. Approach end-of-life care with compassion, dignity, and respect. Your presence and gentle touch can make all the difference. Bridging the gap: effective communication in CNA care. As a CNA, you're not just providing physical care, you're building relationships. Effective communication is the bridge that connects you to your patients, fostering trust, understanding, and a sense of well-being. While medical knowledge and technical skills are essential, the ability to communicate clearly, compassionately, and respectfully is equally crucial for providing truly patient-centered care. Remember, communication involves more than just words. Your body language, tone of voice, and even facial expressions speak volumes. Approach each interaction with a warm smile, maintain eye contact when appropriate, respecting cultural norms, and lean in slightly to show you're engaged and listening attentively. When communicating with patients, always speak clearly and slowly, especially if they have hearing impairments or if English isn't their first language. Avoid using medical jargon or technical terms they might not understand. Instead, opt for simple, straightforward language that's easy to comprehend. Active listening is paramount. This means not just hearing the words your patients are saying, but truly paying attention to their message, both verbal and non-verbal. Repeat back what you've heard to ensure understanding, and ask clarifying questions if needed. Never interrupt or dismiss their concerns, no matter how small they may seem. Cultural sensitivity, embracing diversity in healthcare. In today's diverse healthcare landscape, cultural sensitivity is essential. As a CNA, you'll encounter patients with unique beliefs and practices. Embrace this diversity with sensitivity and respect. Cultural sensitivity starts with awareness. Recognize that a patient's cultural background influences their healthcare perceptions. Some cultures value family involvement in decisions, while others prefer individualistic approaches. Learn about your patient's cultural beliefs and practices. Ask open-ended questions to understand their needs. Avoid assumptions based on stereotypes. Respect diverse communication styles. Some cultures are direct, while others use non-verbal cues. Adjust your communication style accordingly. Use interpreters for clear communication when needed. Caring for the caregiver. Nurturing your well-being. As a CNA, you pour your heart into caring for others, but it's crucial to care for yourself. The demands of this profession can be taxing, making self-care a necessity. Prioritize your physical health with regular exercise. Eat a healthy diet to fuel your body and mind. Get enough sleep to recharge. Manage stress with meditation or deep breathing. Connect with colleagues for support. Caring for yourself is an investment in your ability to provide compassionate care. The enduring heart of healthcare. As we conclude this ultimate CNA guide, we celebrate the profound impact CNAs have on the lives of patients and their families. Your dedication, compassion, and unwavering commitment to providing quality care are the heart and soul of healthcare. Remember, the skills and knowledge you've gained throughout this guide are just the beginning of your journey. The field of healthcare is constantly evolving, so embrace every opportunity for continuous learning and professional growth. Stay updated on the latest advancements in patient care, seek out mentorship opportunities, and never stop asking questions. As you navigate the complexities of healthcare, never lose sight of the human element. Treat each patient with dignity, respect, and empathy, recognizing that behind every diagnosis is a person deserving of compassionate care. Your gentle touch, your listening ear, and your unwavering dedication can make all the difference in their healing journey. As you move forward in your career, carry with you the knowledge that what you do matters. You are the heart of healthcare, and your contributions are invaluable. Thank you for choosing this noble profession, and best wishes for a fulfilling and impactful career as a certified nursing assistant.